Welcome to our guide on type 1 diabetes and the latest in diabetes research. Type 1 diabetes is a condition where your body can't produce insulin, leading to high blood sugar levels. This can impact various aspects of your health. In this video, we'll dive into the importance of diabetes awareness, share valuable health information, and explore the innovative technology of flash glucose monitoring. This new advancement can help people manage their blood sugar levels more effectively. Stay tuned as we unpack these critical insights and advancements in diabetes care. Diabetes happens when the pancreas's beta cells are damaged, leading to insufficient insulin production. Insulin is a crucial hormone that helps regulate blood sugar or glucose levels in the body. Type 1 diabetes is primarily triggered by an immune system response that mistakenly attacks the beta cells in the pancreas. This condition often first appears in children and young adults, but it can develop at any age. Insulin plays a vital role by allowing glucose from food to enter the body's cells, where it is used for energy. Without enough insulin, glucose cannot enter these cells and instead builds up in the bloodstream, causing high blood sugar levels or hyperglycemia. Over time, this excess sugar can cause widespread damage to the body. Additionally, the cells are deprived of glucose, which they need to function properly, leading to fatigue and other health problems. While lifestyle changes can help prevent type 2 diabetes, they cannot prevent type 1 diabetes. There is currently no cure for type 1 diabetes, but it can be effectively managed with proper treatment and care. The symptoms of type 1 diabetes often develop rapidly over a few days to weeks. They include increased hunger and thirst, frequent urination, blurred vision, tiredness, and fatigue. Unexplained weight loss. Anyone experiencing these symptoms should seek medical attention promptly. For approximately 1 in 3 children, the initial signs of type 1 diabetes may be those of diabetic ketoacidosis, DKA, a potentially life-threatening condition. DKA occurs when excessive ketones build up in the body, causing acidosis, which requires immediate medical intervention. Symptoms of DKA include a fruity smell on the breath, dry or flushed skin, nausea or vomiting, abdominal pain, difficulty breathing, confusion and trouble concentrating. Over time, type 1 diabetes can lead to various complications, resulting in additional symptoms. The honeymoon phase. After a person is diagnosed with type 1 diabetes, their body may still produce some insulin for a period. During this time, insulin levels can fluctuate, and the person may need fewer insulin injections to maintain healthy blood glucose levels. This period is known as the honeymoon phase. In the honeymoon phase, it might seem like the condition is improving because the individual can reduce their insulin doses. However, this improvement is temporary, and the underlying condition remains. It's essential for people to continue working closely with their healthcare team and adhere to the recommended treatment plan during this time. Complications. Properly managing type 1 diabetes is crucial to reduce the risk of various complications, including diabetic retinopathy, damage to the blood vessels in the eyes, which can lead to vision loss, diabetic neuropathy, nerve damage that can cause pain, tingling, and loss of sensation, especially in the extremities. Wound healing. Problems, nerve damage can make it harder to notice injuries, leading to infections and poor healing. Diabetic nephropathy. Kidney disease that can progress to kidney failure, cardiovascular disease. Increased risk of heart attack, stroke, and peripheral vascular disease. Dental problems. Issues like tooth loss and gum disease. Mental health problems. Conditions such as depression can occur due to the stress and challenges of managing diabetes. Following the treatment plan can help minimize these risks and maintain better overall health. Treatment. The primary treatment for type 1 diabetes is insulin, which can be administered in several ways. Needle and syringe. Traditional method for injecting insulin. Insulin pen. A more convenient and portable option for insulin delivery. Insulin pump. A device that delivers continuous insulin throughout the day. If insulin alone does not adequately control blood glucose levels, additional medications may be needed. One such medication is pramlintide, Simlin, which helps manage glucose levels after meals. A doctor will determine the best treatment options for each individual. Experts currently do not have a precise understanding of what causes type 1 diabetes. It is believed that genetic factors may play a role, as the condition can run in families. Additionally, exposure to a virus might trigger the disease. In such cases, the immune system's response to the virus may mistakenly target and destroy the insulin-producing cells in the pancreas. Some research has explored potential connections between type 1 diabetes and environmental toxins or specific dietary factors, but there is not yet enough evidence to confirm these links. When diagnosing type 1 diabetes, a doctor will perform several blood tests if symptoms suggest the condition. A random plasma glucose test measures blood glucose levels at a single point in time, while an A1C test assesses average blood glucose levels over the past 3 months. These tests can indicate the presence of diabetes, but additional tests are needed to differentiate between type 1 and type 2 diabetes. To determine whether the diabetes is type 1, healthcare professionals may conduct a blood test to detect autoantibodies, which are more commonly found in individuals with type 1 diabetes compared to those with type 2. Type 1 diabetes is a challenging, lifelong condition and is the most common form of diabetes in children. Managing this condition requires young people and their caregivers to have a thorough understanding, the right skills, and confidence to maintain good glucose control. Poor glucose control in young people can lead to severe long-term complications later in life, such as kidney failure requiring dialysis or transplant, limb amputations, blindness, and cardiovascular issues that can result in early death. Traditionally, managing type 1 diabetes involved frequent finger prick testing and multiple daily insulin injections. However, flash glucose monitoring, which collects glucose readings from a device held near a body-worn sensor, is a newer method. The Abbott Freestyle Libre, the only flash monitoring device available through the NHS in the UK, offers an alternative that avoids the discomfort of finger prick tests. The Freestyle Libre sensor is worn on the arm and measures glucose levels in the interstitial fluid rather than directly from the blood. Although the device has been positively received by both clinicians and patients, the impact of its implementation on healthcare provision has not been thoroughly studied. One concern with the national rollout of such wearable technologies is the potential for information overload for patients, their families, and clinical teams. The convenience of the Freestyle Libre compared to traditional finger prick testing has been shown to increase the frequency of glucose readings, giving families and healthcare teams more detailed information. This increased visibility might make families more aware of glucose fluctuations that were previously unnoticed, potentially causing concern. Balancing this increased awareness with the comfort, convenience, and reassurance provided by Libre is important for managing the condition effectively. Qualitative studies have highlighted that parents using flash glucose monitoring have experienced improved emotional well-being and find their role in diabetes management easier. Young people have reported that flash monitoring has reduced the burden of managing their condition and improved glucose control. In recent trials involving hybrid closed-loop technology with continuous glucose monitoring devices and insulin pumps, parents noted that remote access to their child's glucose and insulin data led to better consultations and more effective support from healthcare professionals. A recent study aimed to understand the experiences of young people using Freestyle Libre sensors along with their parents and to assess the benefits and challenges faced by NHS staff in incorporating this technology into their care practices. The research involved interviews with young patients, their parents, and healthcare professionals over several months. These interviews, conducted online, were analyzed to identify themes, which were then mapped onto normalization process theory (NPT) constructs to evaluate how well the technology was integrated into routine care. The findings revealed that young people using flash glucose monitoring reported significant improvements in managing their condition, noting increased confidence and independence. Their parents also experienced a better quality of life and appreciated having real-time data on their child's glucose levels. Healthcare professionals showed enthusiasm for the new technology, adapting to the additional data to offer more personalized support during and between clinic visits. Overall, flash glucose monitoring has helped patients and their families manage diabetes more effectively, enhancing their ability to make adjustments between appointments and improving their experience during clinic visits. Healthcare teams are dedicated to adopting new technologies despite the challenges of assimilating additional information to provide expert advice. This advancement represents a meaningful step forward in diabetes care, benefiting both patients and their families. Thank you for joining us in our comprehensive guide on type 1 diabetes and the latest advancements in diabetes research. We've explored how type 1 diabetes affects the body, from the loss of insulin production to the impact on overall health. As we wrap up, it's clear that while there are still many unknowns about the exact causes of type 1 diabetes, ongoing research and technological improvements are making a significant difference. The ability to monitor glucose levels more conveniently is just one of the many steps forward in enhancing diabetes care.